and welcome to the Dr. Bob Show. A good doctor friend of mine once told me, your foot is your best friend and very slow to heal. The foot has 26 bones in the foot, and by the age of 50, people have walked, most people, 75,000 miles. After age 50, we keep on walking. During that period of time, putting all of the pressure from walking causes lots of problems with the feet. They're put together with tendons and ligaments and sheath and fibrous tissue. There are nerve endings. There are blood vessels that nourish the foot. And so lots and lots of problems can occur. We'll be talking about those on this show. My guest is Dr. Kendale Ritchey. Dr. Ritchey is a board-certified podiatrist. He deals with foot problems every single day, and he'll be teaching you and me how to have happy feet. I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show, and we'll be learning together and walk out of here happy. We're talking with Dr. Kendale Ritchey, board-certified podiatrist, and we're talking about the foot, 26 bones. By age 50, we walk 75,000 miles, and we keep on walking after age 50. Lots of problems can occur. Kendale, welcome to the Dr. Bob Show.
Thank you.
Let's talk about some things that I would call simple. May not be simple to a lot of people. What's the difference between a corn and a callus and a bunion?
Well, Bob, corns and calluses really are the same thing. The reason they have different distinction is location. Corns are almost always on a toe.
On the side of the toe or inside,
outside?
Side
of the toe, top of the toe, can be at the bottom tip end of the toe.
Do they hurt?
They're very painful.
Why do they get them?
Well, a corn is your body's response to excessive pressure or friction on a location where it doesn't need to be. So calluses are mostly formed in the ball of the foot or on the heel, sometimes on the medial, on the inside of the big toe joint. Corns are usually between the toes, top of the toes. Corns are usually a little bit thicker, a little bit harder. Calluses are a little bit more spread out.
So I can remember, even in college days, on the side of my little toe, I would get an overgrowth of callus, of tissue, and I called it, well, that's a corn. How do you treat those corns?
Well, if you have to go back to the origin of the corn.
Yeah.
Why are you getting excessive pressure or friction in that location? So for immediate relief, you want to, you can take a pumice stone, you can soak your foot and soften the skin, and then take a pumice stone and take some of those layers off.
So you said soften it by soaking it and then use the pumice. So the pumice doesn't work as good if you're working on dry skin. You want to sort of wet it down,
No,
loosen
it's kind
it.
of like rubbing oak. It's really hard. so you want to soften a little bit. Now, also you have to remember, I want to say this right up front, if you're diabetic or if you have poor circulation, you don't ever want to touch those yourself.
Yeah,
this is for...
That's the time for the big boys to come in.
That's time for professional help.
Why does a diabetic foot need so much professional attention rather than just getting a pumice stick, soaking your foot, and getting rid of it?
Well, Bob, a diabetic foot is a whole course in itself. But there are some things that run sort of consistent among people with diabetes. Of course, high blood sugar can cause problems. When it comes to the lower extremity, there are three systems that high blood sugar will affect the most. You got the circulation, you got the nerve endings, and then you got the immune system.
And all of those are terribly important to walking around and keeping your legs. Most common cause of amputation is the diabetic foot that we have there.
That's right.
So do you pay more attention to the nerve endings or to the circulation as far as a diabetic foot?
Well, none is more important than the other.
Yes.
If you take a person that has poor circulation, inability to feel things, and that add in there they don't fight infection well, that's a recipe for disaster.
How often do you have to see those people?
Oh, gosh,
That foot?
all day long. Yeah, so I would say probably 25% of our patient population is going to have a diabetic with either peripheral vascular disease or neuropathy or both.
Peripheral vascular disease.
Sorry,
means
that's a big word,
blood
isn't
vessel
it?
disease down the
Yeah.
bottom. And neuropathy.
Correct.
That means the nerve endings are shooting out pain or shooting out deadness.
It can be either.
Yeah.
So high blood sugar sets off this enzymatic cascade of events which damages the coating on the peripheral nerves. And so the nerves essentially short out and they misfire and they send a signal to the brain. It can be tingling, burning, stinging, pins and needles, pricking, or it can be no sensation at all.
So it can have a wide variety of things.
It does.
But once somebody has the diagnosis of diabetes, there's one kind called type 2 adult onset, where their blood sugar just goes a little higher. And the other one, you got to take insulin. Both important?
Both are important. You know, our studies show that the most important thing that I can tell a diabetic isn't wash your foot, put lotion, the type of shoes. The very most important thing I can tell them is your blood sugar is directly related to those complications. So the closer that you can get to keep your hemoglobin A1C, your 3-month average, to normal, those situations do not have to occur.
You know, and the nice thing about that is that we used to have to do a finger stick all the time. Now there's what we call the A1C, hemoglobin A1C.
That's right.
That gives you an idea of what your blood sugar has been the last 3 months. So you can really tell if you're just cheating the night before and eating. You can't fool the doctor with
that number doesn't lie.
A1C. Do most people who come into, most people, let's say between 40 and 60, come in with a bummer for a foot, a bad foot. It's a diabetic foot. And they've got all sorts of problems. Do a lot of them get well because of regular visits if they're sort of working on their blood sugar but not doing as good as they should?
Absolutely. You know, we really do take a team approach. So podiatry, vascular surgery, endocrinology, family doctor, the family internist, we all work together. And you can definitely make a huge difference by regular care. You know, we started talking about corns and calluses.
Yeah.
That's a high pressure spot. So if you're diabetic and you have one, that is a trigger. Hey, I'm getting too much pressure, too much friction in one location. That needs to be treated. And so that's the type of stuff that we do to prevent that from getting worse and worse and then eventually becoming a sore that we call a diabetic foot ulcer, which could get infected, which could lead to surgery, which could unfortunately lead to amputation.
Yeah, and causes eye problems, kidney problems, blood pressure
There's
problems,
a whole host of them.
and feet problems
That's right.
that need to be taken care of. Let's talk about, since we're down on the end of the foot, what's a plantar wart?
Okay, well, plantar warts and corns or calluses, they look very similar. The difference is a wart is caused by a virus. And so this is a virus you can pick up anywhere where you might be barefooted or sandal-footed, where someone has left you a little present. and you step on the virus, it sticks to your skin, and it is able to penetrate into the skin by microscopic cuts that you don't even know you have. And so they start to live in the epidermis, which is the dead layer of skin. They don't live down in the live layer. And they look very similar to a corn or a callus. You can tell the difference, though, most of the time visually, because the skin lines, if you look at your skin lines, they'll come up to the wart and they'll bypass it around, whereas on a corn or a callus, that skin line will go right across the top of the lesion.
Either of them more dangerous or hurt more than the other or harder to get rid of?
It's been my experience that warts hurt a lot more than a corn or a callus. They develop their own nervous center and their own blood supply, and that's those little tiny red or dark dots you see. They're not seeds, they're thrombosed blood vessels in there. But when you step on a nerve ending, it's more painful.
When you go to the pharmacist at the drugstore and say, I got some warts on the bottom of my foot that hurt, are those remedies good enough, or do you need to see a podiatrist, or it just depends?
Yeah. Well, there's a reason that a plantar wart has a distinction over any other wart, and that's because they're much more stubborn. So it's not to say that you can't use an over-the-counter medication to get rid of a wart, but the majority of the time, I said that the wart lives in the dead layer. It's much thicker on the bottom of the foot, so it's hard to get that medicine to penetrate deep enough to actually kill the virus. So,
what if somebody has a blister? I'm going to switch to blisters because everybody's had a blister at some time, and nobody really knows how to treat it. Is there a certain way to treat a blister? Can you treat it improperly and properly?
Well, there's a certain way that I like to treat it.
And that's what we're going to be talking about when we come back. How does I take care of a blister, and can it lead to infection, or is the redness just the body's reaction to the blister? A lot of information that difficult to answer sometimes. We're talking with Dr. Kendale Ritchey, board certified podiatrist. We're talking about problems with the foot, 26 bones. You walk 75,000 miles by age 50. That puts a lot of work on this little old thing we call the foot that we expect to work no matter what we do to it. We've talked about various problems, and now we're going to talk about blisters. I had a protruding sort of heel, and I would get blisters every time I put on football shoes, and they were painful and they hurt, and they get red on the side, and I wouldn't know if they were infected. I would just know they hurt, and they still made me put on those shoes and go out and practice. Tell me about how we handle a blister that's anywhere, and why do we get them?
Well, you know, a blister is a reaction to a sudden friction. And what happens is you'll actually separate the live layer and the dead layer of tissue, and fluid will accumulate in there. And so you push on one side and it squishes, and it pushes on the other side and it squishes. But it also exposes some of those small nerve fibers that are at the surface. And so that's why they hurt so much.
Well, they do hurt.
Yeah, and as the fluid accumulates in the blister, it gets tighter and tighter and tighter, which again stimulates more and more pain.
Yeah.
So
I always wondered, you know, if you just cut the top off and let it drain, people say, don't cut the blister, let it. So what do you do with it?
My personal preference is to take a sterile instrument, and I do like to make a little tiny poke in it and push the fluid out. I do not like to de-roof it. We leave that top layer on as a natural barrier, sort of like your body's own dressing.
So do you, if the blister is like this, do you put the little puncture then at the bottom?
Kind of close to the edge of it, and you want to push sideways.
Outwards.
Don't push down into it because you can penetrate through the dermis. But you want to go to the side and then gently push that fluid out. And sometimes be careful because it will squirt pretty far.
Yeah. And it may come back a little bit, may close over and come back a little bit the next day.
You might have to
do it again, maybe?
Yeah, but then you have to clean it up really good beforehand. And
what do you clean it up with?
Well, a good soap and water.
Yeah.
You can even put some alcohol on to sterilize it a little bit.
Yeah. That might sting, that might hurt me. Soap's okay.
Stings, no pain, no gain, what they say.
Yeah.
But after you're done, then you want to put some antibiotic ointment over it and a small bandage, adhesive bandage.
So when I healed the blister on my heel, I go back to the same pair of shoes and it goes to cause trouble. You have to sort of guide putting some pad there to keep the friction from not occurring. Everybody's different.
It could be anything from, guess what, that shoe's not going to be able to be worn, to you can apply a bandage over it. There's some different products that you can buy over the counter. You can still buy moleskin that you could lay over there.
Yeah.
With runners, a lot of times, if they're in a race and they're trying to finish, they'll lance that blister, sterilize it, and put a piece of moleskin because that will decrease the friction.
Yeah, that's sort of like foam rubber moleskin?
Yeah, it's almost like a piece of felt with adhesive on the inside of it, and it'll just stick right to the skin.
And people would tell me all the time, you ought to get some moleskin, and I would say, what's that?
And moleskin's been around for much longer than me, probably longer than you.
Yeah.
But it's a good product when you're trying to decrease friction. And they have some newer ones too. They have sprays, they have silicone sprays that you can put on. You can buy them in the pharmacy.
And they're all advancements from people having problems that the pharmaceutical industry helps us out by getting a better product.
Correct.
Ingrown toenails, since we're down with blisters, and I was talking about the heel, let's talk about the front of the foot, ingrown toenails. How common, how dangerous?
Well, ingrown toenails are much more common than you might think. They basically have their origin from two reasons. One would be trauma, and I would include cutting your toenail wrong in trauma.
Right off, how do you cut your toenail? Across or angle?
No, you want to cut basically straight across. And then once you get it straight across, I always recommend taking a small file and just making sure you just gently smooth those little corners.
Yeah, because if you don't, they can grab your socks and tear your socks and stockings and whatever.
And they can be sharp. You can literally cut yourself from a toenail if you're not careful, if you have sharp corners.
So you cut them straight across. Is there any kind of toenail cutter at the drugstore that's better than another kind?
Well, they make, the average little clipper that you can clip your fingernails with. They make a larger one for toenails. They make side cutters, which are very powerful, and you can really do some good things with, but you can also cut the tip of your toe pretty badly, so you have to be extremely careful with the side cutters.
You have to know what you're cutting into.
Yeah.
So it will ingrow where?
Yes.
How?
Well, if you think about how the toe, the anatomy of the toe, you have the nail plate, which is the hard part we call the nail. You have the medial and the lateral nail fold, that's the tissue on each side, and then the cuticle back here, which we call the eponychium. Underneath the cuticle lives the nail root. So those are the cells that generate the nail plate.
So it's not so simple as I first thought.
There's really a lot more to it than you might think.
Yeah.
So the cells that generate the nail plate, and the cuticle directs it forward. Some people are born with a nail root that's just wider than average. And those people will struggle with their whole life, always have that feeling like if I don't cut down into the corner, I'm going to get an ingrown toenail. The problem is it sometimes gets out of hand, and they'll cut down in the corner and leave a little spicule of nail. That spicule of nail will cut through that fold of skin, bacteria gets in there, and you get a combination of infection and a foreign body reaction.
So it can get big time.
Yes, you'll get this very large bubbled up tissue that comes on the side of the nail. That's called proud flesh.
So the proud flesh is the pus in the foot.
Yeah, and bleeding.
So does it help at all to soak your feet and to put something underneath the edge of the toenail to make it try and grow away from?
If you have a mild amount of curvature to the nail, and your nail, if you soak it, you can soften a little bit, and you can take a little wisp of cotton, maybe wrap it around a flat toothpick, and just tack it under the edge, and that might be enough to push the flesh away and allow that nail to grow out. But sometimes there's not much you can do.
So what's the real doctor do? What does the podiatrist do if somebody comes in and lo and behold, it looks like the whole toenail has gone into the middle of the foot?
By far, the majority of the time, we do not need to remove the whole nail. Most of the time, we can remove a small edge of the nail. That's called a partial nail avulsion. We have special equipment that's made specifically for this. Once we remove anywhere between 1/8 and 1/16 of an inch of the edge of the nail, then we'll perform a matrixectomy. And that's a big word. It's a big word, I know, but a matrixectomy means basically you're going to destroy the nail root underneath the cuticle, just on the edge. So
do you sort of push something to get rid of the nail bed? What are you doing?
We have a special surgical blade that you can push through the nail plate without cutting the flesh around, and then we can pry the nail off the nail bed just in that one little location, remove it, then that exposes the nail root in the corner, and that's how we can kill the nail root, either chemically, or you can use a laser, or you can use some type of radio frequency to kill that nail root. Then that edge of that nail never grows back. So you still have a nail, it functions normal, it looks normal, you can paint it, you can do whatever you want, but that ingrown won't ever grow back.
So which toe, big toe, pointer toe down on the foot, middle toe, ring toe, or pinky? Well, any foot more prone, any toe?
I would say probably 90 to 95% of the time it's going to be your big toe.
Yeah. If you don't take care of it well, see the pro, the big boy, and get it started right. Yeah. Bunions, are they common?
Bunions are very common.
Can you take care of them?
Absolutely.
That's what we're going to be talking about when we come back. What is a bunion, and how do you take care of those? I already know this answer, I hope. We've been talking with Dr. Kendale Ritchey, board-certified podiatrist, and I didn't realize there's so many things that can go wrong with the feet. And we've talked about most, but we've got at least 50% more that we'll be talking about. What's a bunion?
Well, Bob, the word bunion is actually a really old word, and it means swelling or bump of bone. When we talk about bunions these days, what we're really talking about is something a little more complex than just a bump of bone. It is actually a structural change where the first metatarsal, which is on the inside of the arch, starts to shift towards the midline of the body. What that does is it creates pressure and pushes the big toe away from the midline of the body.
So you end up with a bump at the bone of the big toe.
Right at the base of the big toe, yes.
Does it get better? Does it cause problems? Does it hurt your walking?
Yes, and no. But so it doesn't get better on its own. It is really mostly a hereditary trait caused by an imbalance of the soft tissues, including the tendons and the ligaments that surround the big toe joint. And so when that starts to go, there's no brace, there's no splint, there's no shoe that will correct it. Now, there are some things you can do to alleviate the symptoms. You can wear pads, you can wear rounder toe box shoes.
Where does it put the pain? Right at the corner or underneath, or where?
It can be both. It can be both. The majority of the time, it's right on the top of the foot, right where the big toe meets, kind of on that bump that you see protruding out.
Is it ugly?
Well, beauty's in the eye of the beholder on those, but yeah, most people would say they're ugly, and I would say that men and women pretty much experience bunions in the same amount, but it's very heavy on the women's side who will have surgery for it, because men can kind of accommodate for bigger shoes, whereas the women, they're
conscious of a pretty skinny shoe.
Skinnier shoes, and so they'll have more symptoms. Even though men have them, they don't necessarily have them addressed as often as a woman does.
Can you surgically, as a podiatrist, fix those?
Oh, absolutely.
So what do you do?
Absolutely. Well, you have to go back to the underlying cause. Remember how I was saying that bone protrudes to the inside. That deformity has to be reduced. And then when you reduce that, you can shave off that bump if it needs to be. They don't always need to be, because when you reposition that bump, the bone, sometimes the bump will disappear. And then you reconstruct the joint where the big toe connects to the foot.
How do you reconstruct it? What do you do?
Well, a lot of sutures. So there's actually a resurrection of an old procedure with new technique now. It's called the Lapiplasty. Probably not allowed to say that. But they have made a way to take a very difficult procedure and make it reproducible, so that every single time you can get the bones lined up exactly like they're supposed to be.
Now, we started off the show saying your foot is your best friend and very slow to heal. That's a lot of work in on a little area there. How long does it take it to heal?
Well, it takes bone 8 to 12 weeks to be healed, depending on the quality of the bone and the age of the person. So in that situation, you'd be strict non-weight bearing for a couple weeks, and then you'll be protected weight bearing in one of those really large fracture boots or cam boots for another 4 to 6 weeks, and then gradually back into a tennis shoe, somewhere around 8 weeks.
So is the outlook pretty good for somebody that has bunion repair?
Absolutely. It's changed a lot. If you've talked to someone who had a bunion surgery 30 years ago versus the way it's done now, outcome is much better.
So, in a short period of time, what do you tell people to do to keep their feet healthy in general? Wash them, clean them, take care of them?
Absolutely. It's, you know, like I was saying earlier, you go to the dentist for your teeth, the eye doctor for your eyes, feet doctor, same thing. If you have any concerns, it's not one of those things you want to just let ride. You want to keep your feet clean and dry. You want to wash them daily with soap and water, put lotion. Don't put it between the toes. We don't want to gather moisture in between the toes. Shoes need to fit properly so that you don't develop any corns, calluses, blisters. And also check your shoes every day. Make sure there's nothing down in there.
Oh, I hadn't thought about that.
All it takes is a little piece of gravel, so dump your shoe out before you put it on.
Kendale, you're a great teacher. I want to tell you how important this show is for people's health. And we like to talk about exercise. That keeps your weight down, keeps less pressure on your foot. We talk about eating right so that you'll have the nourishment going down to the vessels. We talk about getting adequate sleep. Get that foot time to rest. And most of all, if you stay happy, you'll have happy feet. Thank you for coming to the Dr. Bob Show.
You're welcome. Thank you.